is the half-life of a medication. You may see T1/2. That is half-life. That's an indication for half-life. A half-life is the amount of time for the drug concentration to decrease by 50%. This is how much drug concentration is within your bloodstream. So it's the time it takes for 50% of that concentration to decrease. This is related to how long the drug is going to work. Some drugs have a half-life of 2 hours. Other drugs have a half-life of a few days. The drugs with a half-life of a few days are going to last a lot longer. Here's a graph showing what a half-life is. So with this drug, the half-life is here. So this is how long it takes the drug to reduce by 50%. How long before the drug reaches half of the initial dose? Thinking of that, we need to know when a medication works. So the onset of action is when it starts working. This is especially relevant in things like pain medication. You have a patient who's in excruciating pain, they're going to ask you, well, when's it going to start working? A lot of times our oral medication will take about 30 minutes to work, whereas our IV medication can work a lot faster. Now that makes sense because it's going directly into the bloodstream. Our peak effect is the time it takes for the concentration to be the highest. How long is it going to take to reach the top? The duration of action is how long the drug will work for. Pharmacodynamics that we covered at the beginning include therapeutic effect, the goal of the drug. What is the drug supposed to do? What effect is it supposed to have? Ibuprofen is supposed to decrease pain, while nitroglycerin is supposed to decrease chest pain. The mechanism of action is how the drug produces a therapeutic effect. How does the drug do what it is supposed to do? Next, we'll discuss monitoring parameters. So how are we going to monitor this drug? We'll discuss therapeutic index, drug concentrations within the body, tolerance and dependence, interactions, and adverse drug effects. Therapeutic index is an important concept to know. We will talk about it throughout the course. The therapeutic index is a ratio of the drug's toxic level to the level that provides therapeutic benefits. So we can see over here, the green check mark is the amount at which the drug is effective, whereas the caution sign is the amount at which the drug is toxic. So between this, in the green area, is when it is when it's at a safe level in the body and when it's working. So a low or narrow therapeutic index means that the amount at which it's effective and toxic are very close together. This makes it a dangerous drug. An example of this is lithium. Lithium is a mood stabilizer medication for bipolar. Lithium has a very narrow therapeutic index. This means the amount that it takes for lithium to work in your body versus the toxic level is very close together. So if for some reason, something like dehydration occurs, the lithium level can go into the toxic range and cause bodily harm. Here's another picture. The blue is the therapeutic effect, and the red is the toxic effect. The therapeutic index is between therapeutic and toxic. Again, another picture. A small therapeutic index is more toxic, and a large therapeutic index is less toxic. Classroom question. The nurse is concerned with minimizing adverse drug-drug interactions for the patient. Which drug characteristic could result in the most serious consequences from a drug-drug interaction? narrow therapeutic index, high biologic half-life, low potency, or first pass effect. So we're looking for, let's see, the most serious consequences from a drug-drug interaction. So basically, what's the least safe? So a narrow therapeutic index, what does that mean? That means the level that is effective or therapeutic and the level that's toxic are very close together. So that could be very dangerous. Next, high biologic half-life. So what's a half-life? A half-life is the amount of time that 50% of the drug concentration is out of the body. Low potency, what does this mean? The drug isn't very potent or very strong. And first pass effect. Remember, the first pass effect is oral drugs must first go through the liver. So you're right, this is narrow therapeutic index. All right, another principle which I do need you to know is peak and trough. So let's say you're giving a patient an antibiotic. They have pneumonia and they're getting vancomycin. So the reason why we do this is to, one, make sure the drug is working, but two, make sure the drug isn't toxic. So think about our therapeutic level. Our peak, this is a level that we're going to get, a blood level is what we can check with vancomycin. We'll look at the peak. So the peak is the highest amount of drug in the body. So with the peak, this would be a time where we would check the therapeutic level. So we would want to make sure that that peak is not above therapeutic index. We would want to make sure that the drug isn't toxic within the body. Our trough level, we get right before the next dose, and that's the lowest level that's within the body. If the trough level is too low, we're concerned that we don't have enough drug in the body to fight the infection. Another thing to think about is tolerance. So this is very big with opioids. So let's think somebody is getting hydrocodone, like Norco or Vicodin. So they're getting hydrocodone. They have knee pain. Say this is 1990. So they have knee pain. They're prescribed hydrocodone. They take one pill. It makes their knee pain better. They're not in as much pain. After a week of taking the hydrocodone as prescribed, they're still having pain. They take that one pill like they were doing last week, and they're still having pain. So then they start taking 2 pills, and the pain goes away. I'm sure we know where this goes, and it's 3, 4, 5. That's a tolerance. The patient has built up tolerance. They're experiencing pain because their body is used to that drug. We need more drug to produce the same effect. Now, tolerance versus dependence is important to know. Tolerance is a decreased response to repeated drug dose. Dependence is a physiologic and psychologic need for a drug. Physical dependence is the body physically needs the drug to avoid withdrawal. So with hydrocodone, the patient may need to take the hydrocodone or they start experiencing sweats, anxiety, nausea, irritability. Addiction is a psychological dependence. All right, so drug interactions. So these are important to know. There's ones that are more concerning than others. But an interaction is about 2 drugs. So something about one drug changes because another drug is present. So we can have an antagonistic effect or a synergistic effect. Antagonistic effects means that the one drug makes the other one not work as well. Synergistic means that the 2 drugs together can cause a greater effect. All right, so food interactions. So I'm sure we've all seen things that say, do not drink grapefruit juice. And I always think, who drinks grapefruit juice? If you do, that's great. Know which medications to avoid. A lot of these require quite a bit of grapefruit juice to cause that interaction. But what happens here is the grapefruit is metabolized through your liver. So there's a specific enzymes that for each drug are required to break down the drug. So grapefruit juice is selfish, so it takes the enzymes and uses them all up itself. The body has to use these enzymes to break down the grapefruit. When that happens, there's not as much enzymes left over for the other drugs. So examples of these drugs are buspirone, which is an anxiety medication, nifedipine, which is for your heart, and simvastatin, which is like Lipitor, that is a high cholesterol medication. So if somebody's drinking a bunch of grapefruit and taking these medications, the body will use the enzymes to break down the grapefruit and not the drugs, and the drugs can build up to a toxic level within the body. All right, next is an adverse drug event. So I'm sure we've all heard of medication errors. We have a whole chapter about it. But an adverse drug event is any undesirable occurrence related to administering or failing to administer a prescribed medication. A medication error compromises one of or multiple 9 rights of medication. And an allergic reaction, think about our example with the gentleman with the penicillin allergy. In his case, if he took penicillin, his body would attack the penicillin like it's an invader. So the body has an immune response to the drug. Penicillin and sulfa are going to be your 2 biggest allergies you're going to see. People can be allergic to anything, but with those and all drugs, the immune response occurs to the drug. All right, we did touch on this. Patients with renal failure would most likely have problems with drug. Which one of the pharmacokinetics? Excretion. So our kidneys excrete the drug and get them out of the body. What's the main organ that metabolizes drugs? It is the liver. Good job. During which step does the entry of drugs into the bloodstream occur? Absorption. Remember, the drug is crossing the membrane to get into the bloodstream. What is the fraction of unchanged drug reaching the systemic circulation? Unchanged drug, bioavailability. What percentage of bioavailability is an IV medication? Correct, 100%.